Hi guys, I'm Cultural Skeptic. Today I'm going to talk about chiropractic. I'll go over the claims chiropractors make, what the science says, and whether chiropractic can stand up to scientific scrutiny. But before I get started, I have a couple of things to point out. First, I'll stick to the facts as defined by scientific research. When I give my own opinion, it will either be based on the research or I will say that it is not. I know this is a heated and complex topic and I will try to stay as objective as I can. Second, I live in Australia, so this video is largely Australian focused. When I give dollar amounts, I'm talking about Australian dollars. When I talk about laws and agencies, I'm talking about Australian ones. You will find all of my sources and credits in the description. So, how did chiropractic start? What is its origin? I'll get to that right now.
Chiropractic therapy was founded in 1895 by an American magnetic healer called D.D. Palmer. In his building worked a janitor who complained he was hard of hearing. D.D. Palmer decided to perform an adjustment on the man's spine, and in a miraculous feat claimed to have cured him of profound deafness. Palmer hypothesised that aligning the spine unblocked nerve flow through the body and restored the man's hearing. From this, he proposed that a misaligned spine was the cause of virtually all human ailments.
That is the story in a nutshell. Based on that one case, Daniel David Palmer decided that almost all disease was due to subluxation. He said that he was the first to adjust the cause of disease in a speech that I'll put in the description. Is the story plausible? No. First up, we can't prove the story is true. Second, he only adjusted one person. Far too small a sample size to get any kind of conclusion. Third, from what we know about anatomy now, it would be impossible for a back realignment to cure deafness anyway. If you don't believe me, maybe you will believe this guy.
There's no nerves that control hearing that have anything to do with the neck. They all come from the base of the skull, which simply cannot be influenced by any sort of spinal manipulation. I would have concerns over someone's appreciation of anatomy if they were to claim that the middle ear in the eustachian tube is affected in any way by a nerve that comes from the spine.
Tony Croak explains that even the slightest misalignment in the spine can act like a traffic jam in the central nervous system and lead to disease. In chiropractic circles, it's called a subluxation.
And so it's not necessarily that you have to compress the nerve root on the way out, but in fact the messages coming back in can be distorted because of that static in the nervous system travelling back up.
Chiropractic hinges on three ideas. Bones are out of place. These displacements cause nerve interference, and manipulating the spine puts the bones back into place, removing the nerve interference and restoring health. There is no credible evidence to support any of these claims. Real subluxations, which are partial dislocations, show up on X-ray. Chiropractic ones don't. In 1966, a group of physicians wrote, "In all the years that they have been talking about them, chiropractors have never been able to furnish proof of these mysterious subluxations which they alone are able to see. They may convince their clients, but have never provided proof of their pretensions to men of science." Wow, harsh. When X-ray disproved the subluxation claim, chiropractic changed its definition of a subluxation. Most chiropractors still claim that subluxations are a thing, and the burden of proof falls on them to prove it.
Dr. Michael Vagg is a pain specialist and disagrees with the chiropractic theory about traffic jams in the central nervous system. During surgery, he deliberately scrambles the nerve signals to the spine so that patients can get pain relief.
We use spinal cord neuromodulators to electrically scramble the information that's going up and down the rear part of the spinal cord, and we see no evidence that that produces anything other than pain relief in most of our patients. So I think those observations are not consistent with the chiropractic view that optimum health depends on there being absolutely no interference with nerve function at all.
So, is there evidence to support chiropractic, despite the subluxation thing not being true? It depends on what chiropractic is trying to treat. Does it work for what? Does what kind of chiropractic work? It isn't a fair question to ask of all of chiropractic. Sadly, there is a severe lack of quality studies of chiropractic. Studies are plagued by small sample sizes, bad study design, etc. Almost every review into the literature laments the lack of quality studies. Nevertheless, researchers have studied chiropractic effects for many conditions, from back and neck pain to asthma, fibromyalgia, headaches, and many other things. There is evidence to show chiropractic can help with migraines and lower back pain, but this evidence isn't very strong. The lack of quality studies are a serious problem, which means that you need to take the studies with a grain of salt. A major 2012 review supports that, saying that chiropractic is no better than placebo. The causes for lower back pain vary wildly, which obviously doesn't help. With other conditions, for example fibromyalgia, mid-back pain, neck pain, tension headaches, and premenstrual syndrome, the evidence for chiropractic is inconclusive. As for the other claims of things they can cure, like asthma and HIV, many of these claims have been thoroughly debunked.
This Sydney-based chiropractor claims to correct the length of a child's leg with a clicking device called an activator.
First we adjust this. No complaints there. And we get an instant lengthening, see?
I mean, what could you ask more? Just a few clicks and the child's chronic problem is fixed.
So how unscientific is that?
Well, it's totally unscientific. Obviously, when you're positioning a child on the bench like that, you can do anything with your legs. And then he moves the legs until they're equal. And the random clicking away from the buttocks to the upper spine with the instant results, this is what is so objectionable.
Various areas of muscle spasm around the vertebra.
Well, it's interesting that the adjuster is then used on the neck, where there are no anatomical structures that, if you altered them in any way, would fix leg shortening.
Good, she's done.
The odd thing about this clip is that a few seconds after he let her leg go, her leg went back into its old position. If you don't believe me, let me show you with a close-up. Back and neck pain is rare in kids, but the most common cause is heavy backpacks. A child's backpack shouldn't be heavier than 20% of their body weight. I couldn't find any evidence to show whether chiropractic can help with back or neck pain in school-aged kids. The more pressing issue, at least in my opinion, is the chiropractic treatment of babies. Chiropractic says it can treat conditions like trouble breastfeeding, colic, fever, cramp, allergies, wheezing, autism, and sleeping problems, among other things. Many of them say that vaginal childbirth can misalign the spine, leading to problems later in life. Is this true? Well, sort of. Babies sustaining physical trauma during childbirth are rare, but they do happen, and they need specialist medical treatment, not a chiropractor. Outside of that, there is no evidence for these claims. Infantile colic, characterized by excessive crying, is considered benign by doctors but is very distressing for parents. It's the most common problem seen by doctors in the first 16 weeks of a child's life, and it usually disappears by the age of 6 months. An online video of a 4-day-old baby being treated by a chiropractor went viral a few years ago and got a huge response. It isn't easy to watch. There's a loud crack as the chiropractor pushes 2 fingers into the newborn's back. I have very deliberately chosen not to show the footage here in this video because I don't want your emotions to overtake your rationality. That and it is not easy to watch. I will include a link to the video in the description. Back then I heard many defenders of chiropractic say that chiropractors are much gentler with babies than they are with adults. Well, no shit, Sherlock. But does the treatment work at all? There are many studies of the effect of chiropractic on colic. The most common study method is to do the chiropractic treatment or a sham manipulation on the babies, then have their parents record a crying diary. As with the adult studies, infant studies are plagued by small sample sizes and bad bias control, especially lacking in performance bias prevention. In this context, poor performance bias control means that the parents know whether the babies in the studies have gotten the real chiropractic treatment or the sham manipulation. Comparing studies with good and bad performance bias control showed that the performance bias had a significant effect on the results. How? The placebo effect is a very good possibility. You might be wondering how the placebo effect could possibly affect a newborn baby that has no idea what chiropractic is. That is a good and fair question. The answer is that while it doesn't affect the babies directly, it affects their parents. Babies are very responsive to the emotions of their parents. Despite all of this, spinal joint popping is something that some people seem to like. There is no conclusive evidence that spinal manipulative therapy is more effective or as effective as other forms of treatment for patients with acute or chronic lower back pain, as I have said. However, many people report positive results from chiropractic treatment. Many people seem to feel that a spinal adjustment is like scratching an itch they can't reach. Joint pops are a novel sensory experience, a small blast of stimulation. For some people, a joint crack feels like getting unstuck. For other people, it is like fingernails on a chalkboard. This could explain why potential benefits of chiropractic are so hard to pin down. Whether a joint crack feels refreshing to you depends on how you feel about joint cracking. Therefore, results of the treatment will probably depend on how you feel about getting cracked in the first place. What could be causing this variation in results? One possibility is the placebo effect. If you like joint cracking, the placebo effect will kick in, making you feel better. If you don't like getting cracked, it probably won't. The placebo effect also explains another widely reported feature of chiropractic. The benefits often don't last long. Soon the itch needs to be scratched again. The placebo effect is very real and much more powerful than most people give it credit for. Could people's opinions of joint cracking be impacting the results of the studies I mentioned at the start of the video? Maybe yes. Someone who hates getting their joints cracked probably would not sign up for a clinical trial if they knew chiropractic was involved.
Do you think it could be placebo?
I bring focus to the fact that I want them to feel safe, and that one of the knock-on consequences of that, just as a side benefit, is that there may be a better placebo effect, that they might feel more confident and they might have a better outcome just because of that. I'm okay with that.
Wait, what? When I first heard that, I got a housemate to watch it for a second opinion. She said he didn't answer the question and confirmed the suspicion I had. He was asked a simple question and responded with confusing word salad, seemingly in an attempt to dodge the question.
What's most disturbing about chiropractors being the first port of call in the health system is that many don't support vaccination, which is the most basic form of public health care. Chiropractors are the largest number of professionals that support one of Australia's most misleading anti-vaccination lobbies, of which Tony was a member.
I have been in the past, yeah, and I'm not now. And that was my reason for being involved, was to just access that data and have a look.
So what's your view after you've viewed the data?
My view is the same as the Chiropractors Association, that is that it's not what I do. People need to make an informed choice and need to chat to their GP about it.
Are you personally for or against vaccination?
I prefer not to. My own research and my own choices have been made, and that's personal to me. The Chiropractic Association does not deal with vaccinations. We're neutral.
Okay, now you have made me mad. I am mildly immunocompromised, so the lack of a solid stance on vaccination really hits close to home, damn it. The Chiropractors Association of Australia's 2009 vision statement declared that they want to be people's first point of call with healthcare. I just can't.
The federal government appoints a regulatory board to preside over chiropractors. They enforce codes of conduct and ensure public safety. But the integrity of this regulator has been questioned over their failure to encourage that chiropractors support vaccination.
We're not here to promote clinical guidelines or those sort of clinical areas.
But you're supposed to be protecting the public.
We are, and where that has come to our attention as a notification, we've dealt with it satisfactorily.
But it seems in vain. The waiting room is full of misleading information. Here, a booklet by AVN, a widely discredited anti-vaccination group. This book suggests that parents delay their child's vaccination program and even recommends using scientifically unproven homeopathic vaccines as an alternative. Patients are enticed by celebrity endorsements and unscientific remedies. Websites are riddled with false information that chiropractic can help with conditions like autism, ADHD, even HIV. This from a profession that claims to be science-based, and yet it all appears lit past the regulator.
Well, I don't know. We haven't been made aware that that's still the case.
So
we don't actually go out and look for it. The onus is on the public and members of the community to bring it to our attention.
How is the public meant to know whether or not the information they're receiving is correct to bring it to the board in the first place?
I don't particularly have the answers for that. We're very conscious of not over-regulating, but at the same time not under-regulating. We're trying to always maintain a right touch or a proportionate, what we call a proportional approach. But it is difficult, and it's certainly a challenge, and I take your point.
If chiropractors can get away with promoting homeopathy and not supporting vaccination, then this regulator clearly isn't doing its job. The public has to report. What kind of crap is that? A 2006 Gallup poll rated chiropractic dead last among health professionals in regard to ethics and honesty. There is good reason for this. Chiropractic often involves many expensive but quick treatments, and they encourage frequent visits. They sometimes use scare tactics and marketing and sales tactics that many consider unethical. One tactic that gets heavy criticism is the sale of prepaid treatment packages. Proper doctors do not work like this. You see them when you need them. The sale of many other services and products that are blatant quackery gets chiropractors even more heat. They also get a lot of trouble for recommending treatments for children and babies, as I went into earlier. As mentioned earlier, there are often anti-vaccination pamphlets in the waiting room and expensive quack treatments too. Chiropractic has struck down criticism with heavy-handed tactics in the past, though this sometimes backfires. Science journalist Simon Singh was sued for libel by the British Chiropractic Association for comments he wrote in a column in The Guardian in 2005. The lawsuit failed, it was all over the news, and the attempt to shut him up did serious harm to the reputation of chiropractic. Spinal manipulation is not risk-free. There is evidence showing at least half of all patients get mild to moderate negative effects after seeing a chiropractor. These are mostly local and usually last for 2 to 3 days. I can personally attest to this. When my aunt talked me into seeing a chiropractor, I had headaches and neck pain for days. And those who get headaches are sometimes the lucky ones. Chiropractic adjustments can tear arteries in the necks, and this can cause strokes that have killed healthy people. In children, it has been known to cause bleeding in the brain and paraplegia, leaving the child crippled. Those risks are low, but considering the weak evidence supporting chiropractic for back pain and lack of evidence of it helping many other things, are even low risks worth it? I don't think so. If there is little evidence that a treatment will help, then serious risks, even if they have long odds, are completely unjustifiable, at least in my opinion. It utterly fails the cost-benefit analysis. Yes, people die from conventional medicine too. I'm not saying Big Pharma is perfect, or even close to it. However, conventional treatment has a higher standard of evidence that must be met for a treatment to become conventional. This is not so in chiropractic. Hundreds of deaths from chiropractic have been reported, but due to underreporting, they are probably the tip of the iceberg. For example, it has been shown that in the UK, the underreporting is close to 100%. Therefore, the actual number of deaths are anyone's guess, but it would be much, much higher than the official number. It gets worse. Alternative therapies do not always harm people directly. Going to a chiropractor instead of a doctor can cause serious underlying medical conditions to go undetected or to not be detected until it is too late. Just go to whatstheharm.org. Among the reports of strokes and clinical misconduct, you will find heartbreaking stories of diagnosis and serious medical conditions being delayed, and sometimes until it is too late, because people made chiropractors their first point of call.
Couldn't find a single significant adverse event in the care of children by chiropractors. Somewhere in the world in the last 20 plus years, someone would have said something that would have ended up in the medical literature, at least somebody somewhere. But to have a zero result, that's pretty decent.
I think Tony could have looked a little harder in the literature because without a lot of difficulty I found a paper from 2007 in a very widely known journal called Paediatrics, which documented some very serious adverse events, including 2 fatalities and including 20 delayed diagnosis of serious conditions like cancer and scoliosis, etc., where those people had been managed by chiropractors. So that's just one study. When one looks to the literature, you do find these things if you look hard enough.
The problem is chiropractors don't have a formal system in place for recording adverse events.
Our subject isn't cool, but he fakes it anyway. He may not have a clue and he may not have style, but everything he lacks, well, he makes up in denial. So don't defame or play us straight. You know he really doesn't get it anyway.
Then you consider the amount of money spent on these appointments. An average price per appointment is not easy to find, but when my aunt took me to see a chiropractor, it cost me $60. Let's say an average treatment is $40. How many appointments will you get? Chiropractors often try to get you to come back monthly, fortnightly, or even weekly. My aunt's chiropractor told me to come every week. When I told him I simply couldn't afford it, he insisted, and only relented and said that fortnightly businesses would do when he realised he was about to lose my business. I went every fortnight for 2 months. To tell you the truth, they talked me into thinking I had symptoms I never had.
But when it comes to coughing up money, it's the taxpayer that loses. Last year, the government spent over $10 million on Medicare rebates for chiropractic services. A quarter of that was for paediatrics. Professor John Dwyer says it's abusing the public purse.
Yes, absolutely. And that's why we wrote to the Health Minister asking her to have the Chief Medical Officer's review of what practices the government puts money into. And the answer was, no, we're not going to do that for chiropractic because we've got a National Registration Board which is going to protect the consumers. It palpably is not. Look at the chiropractic websites and you'll see just how determined and how penetrative this nonsense is.
In Australia, chiropractic is covered by private health insurance as well. There are 2 types of health cover here, private insurance and universal health care. The government is encouraging people to get private insurance. Most Australians with private health insurance get up to a 30% rebate from the federal government depending on their income. An overhaul of the private insurance system means that from 2019, rebates for many unproven natural therapies will be banned, like aromatherapy, herbalism, homeopathy, kinesiology, naturopathy, Pilates, reflexology, Tai Chi, yoga, and several others. Insurance will be able to offer them, but the lack of a rebate will drive up the cost of the therapies, discouraging some people from using them. Chiropractic and acupuncture are not being cut, but is still a step in the right direction.
Chiropractors have relied on anecdotal evidence. And I think because of their fervent belief in what they do, that they disregard or put aside the scientific evidence, which shows that it's either ineffective or inconclusive.
To the right.
John Reggers, a chiropractor, says he only treats musculoskeletal problems and that adjusting newborns is ridiculous.
Now you've got an infant Okay, that nervous system is not developed, its bony structure isn't fully developed, so I fail to see how anyone could find a problem with a 1-week-old baby by touching their spine. And therefore,
He says many paediatric conditions resolve spontaneously, like ear infections.
we know from all the literature that 80% of those children will be better within 5 to 7 days without any treatment. So if you take your baby to a chiropractor with a middle ear infection, he treats the baby gets better. Well, he's taking credit for it, and you also think that he's performed a miracle.
What concerns you the most about chiropractors treating very young babies?
I don't think the general chiropractor is trained well enough to actually diagnose problems with infants.
Chiropractic is a divided profession, and chiropractors can largely be divided into two groups, straights and mixers. The mixers are mostly a minority of chiropractors who reject subluxation and want to modernise. The straights are traditional chiropractors. Mixers are a mixed bag. Some stick to science, but others sadly use quackery. Regardless, the good mixers limit their expertise to areas where there is evidence of efficacy. A science-minded mixer is obviously your better bet if you want to see a chiropractor, but sadly it is nearly impossible for patients to tell which is which. Without appropriate criticism, the good in chiropractic will never be sifted out, and competent chiropractors who have a lot of value will not receive the recognition they deserve. If I were to describe chiropractic with one sentence, it would be more research is needed. Until it can be proven to work beyond placebo and beyond reasonable doubt, it should not be anyone's first point of medical call, and it definitely should not be covered by government rebates. Regardless, the subluxation rubbish must go. Chiropractors have in-depth knowledge of the anatomy of the spine, and it would be wasteful to throw them away though. There is another way to fix things. If subluxation is abandoned and chiropractic starts following science, their skills would make them excellent spine specialists. They would be very useful and do a lot more good than they are doing now. Should the Australian government stop insurance rebates for chiropractic until it is proven to work, or until chiropractic starts following the science? Clearly not. Should insurance be offering it at all? Well, yes, but in my opinion, people should at least have the opportunity to opt out of receiving alternative therapies in exchange for cheaper premiums. Please let me know if you agree with my assessment. If there is any information I missed, or if there are studies I missed or didn't find, please let me know. Constructive criticism is welcome. Just be specific about where I could improve, and please don't be rude, okay? Well, thank you very much for watching and have a nice day.